Welcome to February's Chief Executive Shout Out. This month, for February Chief Exec Shout Out, we're going to focus on that really important topic about staff health and wellbeing. That's so important, and I know colleagues have been digging deep for a very long time now, and we're going to hear from Claire in a moment about that work, but also that February is LGBT plus month, and I'm going to be talking to Jon King not just about the importance and significance of our rainbow badges, what it means to make a pledge, but also how we support staff to make sure that they've got safe environments on which to talk to each other about any issues that are affecting them. So we're a year in now for the pandemic, and I know everyone's having to dig really, really deep, and we've worked really hard to provide really good services for our patients. But my top priority is also then about how we take care of all of our staff. We've tried really hard to make sure that the health and well-being of our staff throughout the peaks and troughs of managing the pandemic, that we've really put your needs first and to provide you with the right level of support. And it's really important that we think about this as an early top-up, so it never needs to reach crisis point, that there's always some help there to support you. And that is whether you're working in some of our frontline, most intense services, whether you're working from home or whether you're shielding. Everyone has absolutely had their own experience of psychologically what it's like to live and work in this pandemic. And I know that there's some work that we'll need to be doing as we move forward as well. So I'm really, really delighted that I've been joined today by Claire Pethick, who is our Senior Counsellor for Staff Health and Wellbeing here at Occupational Health and Development Team. And I wanted to ask Claire a few questions because I think it's great that we've got such a great resource within our services. So Claire, do tell me a little bit about the work that you do and how we've been helping people over the last year.
Well, thank you, Anne. Thank you for the opportunity to talk about the work that we've been doing over the last year. Most of our work has been now carried out remotely, so we've had to be working from home. So we've had to transfer a lot of our work to telephone work or online, which was quite a change, I think, for everybody. But we've all got used to that, and that seems to be well received by staff as well. So, in one of the big offers that we had in place as well over the last year was the psychological support line for staff that we put in place with the trust psychologist. So that was a really good opportunity to work, with other people across the trust in a collaborative way. Part of our new offer that we're really excited about is the introduction of something called single session therapy, which has allowed us to really reduce our waiting list for counselling, whereas in November I think we were looking at sort of 15 weeks. We're now down to it's gone. We don't have a waiting time anymore, which is thrilling for us because the whole point of the work is that we want to be able to provide support for people when they need it and not when we're able to supply it.
So just tell me, what is that single session? What is it, and what will people have when they go away from that?
Is based on the premise that actually evidence shows that most people that access counselling only have one session. So the theory is make that session count as much as possible. So it's about providing a highly focused session for somebody almost as soon as they've asked for it. So we send each person that inquires about counselling a referral pack that includes a questionnaire which we then ask them to fill in as completely as possible. And as soon as we receive that back, we'll get in touch with them and book a session and book in that single session. Now, this doesn't mean that we're not providing all of the other forms of support that we had previously. But what it means is that most people actually don't need that support. So it's about providing, appropriate support to people rather than a sort of, we offer 6 sessions and everybody has that if they don't need it.
So I've often heard that this single session therapy is a bit like an MOT, a bit of good looking after yourself before you perhaps become more seriously unwell or stressed, or before a situation becomes a crisis.
Yeah.
So what can people do just to make, as well as this service, just to keep themselves a bit of self-care, a bit of support? What sort of things can they be doing right now?
Well, I think you're absolutely right, Anne, that keeping our own emotional well-being, as part of our general well-being process, is really important. So I think single session therapy really lends itself to that sort of check-in, one session, I have something on my mind, or I just want to get something off my chest. It can be used in that way so that things don't build up, as well as providing that opportunity for people to access other more sort of intensive forms of support. But I think also other things that people can do to look after themselves would include talking to people, to their nearest and dearest, to their friends, to their colleagues. I think everybody's struggled at some point over the last 12 months, and nobody's immune from this. I mean, one of my favourite sayings that's come out from this year is, we're not all in the same boat, but we are all in the same storm. I think that really, highlights that some of us are better resourced than others. And, it's to understand that we're all meeting this situation in a very individual way. So to reach out to other people, to be kind to ourselves, to perhaps just, have more realistic expectations of what we should or shouldn't be doing. To find a way perhaps of putting some of the demands on us to one side, or not necessarily picking up other demands that we feel that we should be doing.
So important, isn't it, that when so much is being asked of people, wherever they are in the trust, and with families and loved ones, that you do take some time to care for yourself. And I think this is a really good range of services that we've continued to offer, and we've adapted it and changed. So Claire, thank you, and thank you to you and your team for all the support and commitment that you've shown over this last year when it's been difficult for everyone. And I think the real message from this is that we're here for our staff as well, and no one need leave it to get to a point that it becomes a crisis. And just think of it like an MOT or a pop along to the dentist, or a bit of me time, which I think is really, really valid. So Claire, thank you, and thank you to your team.
Thank you very much, Anne. Thank you.
So as always, things don't stand still, and we've had a lot of change and some really exciting things to look forward to. Many of you know that Nick Thomas, who's been with the Trust since he was a boy, and is retiring in March. And as the Deputy Chief Executive and Director of Planning and Estates, it's really important that we were able to get a new director in that could fill a very big gap that Nick will leave. So I'm really delighted that Stuart Windsor has been appointed as the Future Hospitals Director, and he will seamlessly start as Nick leaves. And that's one of the things that we can really start to look forward to as we emerge out of this pandemic, and we emerge stronger, not only about the work that we've done and the conversations we've had, but some real improvements that I know we all want for this wonderful hospital. So we have secured the money for a new emergency care centre, along with hybrid theatres. So we're talking about £100 million worth of investment, and we're going to start doing that work really soon. So right by the helipad around the front of the hospital, in months to come, you will see much more activity. And what's important is I've not forgotten that we are one of a small number of hospitals that have been identified back in October for a new hospital build. And I'm really hoping, by working with our partners, our local MPs and nationally, that the build of the new urgent and emergency care centre with our hybrid theatres will, if you like, be the gateway into the redevelopment and the new build of the hospital. And there'll be more on that coming in future months of Chief Exec shout-outs. So something really good to look forward to. February is LGBT plus month, and this is a really important opportunity for us across University Hospitals Plymouth to just relaunch the rainbow badges, and also to just tell you a little bit about the staff networks that we've established over the last couple of months, and one of those groups is LGBT+. Now, as part of our relaunching of our badge and just taking our commitment forward, we've been able to pull together a promotional video, and I'm really delighted that Jon King, who's joining me today, who really scripted it, has been part of that movement and has really helped us with our film. So Jon, welcome, and thank you for joining us today. Just in your own words, tell me what this badge means to you.
So the Rainbow Badge has always been part of the LGBT plus community. I think one of the things to be aware of first is what the LGBT plus acronym means. So it stands for lesbian, gay, bisexual, transgender. And the plus means every other label and non-label that people use to identify themselves. The rainbow helps other colleagues, staff members, and just visitors to their trust identify those that they can talk to in a non-judgmental way if they should have feelings or thoughts or questions. And if we can't help them, we'll find the answers or someone that can help them in any way possible.
That's really helpful, and I think what we ask people to do, and I've got my badge as well, is that you make a pledge. So this isn't just a badge that you wear. This is a personal commitment about what you're going to do, isn't it?
It's about understanding how it was generated and actually your responsibility when wearing it, because again, it's not just an item of jewellery to be worn on your uniform. It's about understanding that some of the difficulties that people can go through. And again, it's not just around their sexuality. It could be around anything within their life or their personal life, which causes them questions or can sometimes upset, or even they're just unsure about. So it's important that you understand what the badge symbolises and actually what your responsibility is. Now, it's not just worn by people who identify themselves within the LGBT plus bracket. It's about our allies as well, so our supporters and those that recognise that there are difficulties when you live within a different lifestyle, and those that can go alongside it.
But just, I mean, you're doing your master's degree and you've got a nursing background. Just tell me and give me some examples of why this is important for our patients as well.
So for patients, we know that emotional care is a massive aspect within healthcare as well. And the badge can act as a conversation opener for something they may choose to not have normally discussed. So it can be used to identify someone that you can talk to about your feelings, about your experiences, and get advice and information and support to help you along.
I mean, my understanding of this is that all the evidence suggests that if people feel unable to speak up about their particular issues because they're anxious about being judged or people taking a view, then they don't get access to the right healthcare that they need. And if our job is to make sure that irrespective of who you are, we care for you, that's really important, isn't it?
Yes, and like I said, I think it's an important conversation opener, and it means that we're not just here to deal with your healthcare needs, we're here to support your emotional needs as well. And part of good healthcare is health promotion, and health promotion is part of wellbeing. And this is what this badge can lead to, whether or not it's supporting someone with the way they're thinking or feeling, or advising them on the appropriate guidance and where to seek that further support. And if we don't have the answers, we'll be able to help direct you to places that those answers can be gained.
And I think one of the things that we've got to sadly recognise is that we still do have prejudice in our wider society, and we need to call that out, we need to identify it and deal with that. And one of the things that we've done across the Trust is our staff networks, and we have a staff network which is just developing and finding its feet for LGBT plus colleagues. And what sort of things do people talk about at the network? What's important if you identify with the group?
So I think firstly an importance is self-awareness, because even as a member of the LGBT plus community, I still am not aware as I should be of things like binary labelling and things like that. So we discuss on ways that as a community within the organisation, we can promote that and make sure that we're achieving best practice, and then share that with colleagues. I mean, you touched on the fact that there's discrimination still within society, and often you'll have people ask, why is there still such a need for things like gay prides or networks such as what we're developing? And that's because we still see quite widely spread prejudice. That may be through lack of understanding, but again, it's a belief that as a team we can try to prevent that from happening, and as an organisation say that will not be tolerated.
I think that's absolutely right, and I think we've got a diverse population group, we've got a diverse staff group, and we're the richer for it, and we need to make the most of that, and that's really brilliant. And I'm really pleased that we've done quite a lot for February LGBT plus month. Now what we'll be doing, I think, is making sure that we are sharing how you can make your pledge for a rainbow badge, and I know that we've got huge numbers now, which is brilliant, and we'll continue to put information out. Jon, thank you so much, and thank you for all the work that you're doing on this.
That's right, thank you.
And finally, just for this February Chief Exec shout out, just make sure that you have a look at some of our fantastic COVID stories, which really are very, very heartening. Now, over 1,500 of you have signed up to this, our One Big Team staff app. I don't know what you can't do on this app, but it's a really easy go-to place, importantly for your staff health and wellbeing and what services you can access, but also about information, annual leave, e-learning. We're developing this all the time, and I really hope we can get more people to download it and start to use it. We're trying to make life as easy as possible. And then finally from me, just to say, it's really, really important that you all take care of yourselves and each other, and make sure you use some of the services that we've got. Really, it's important that you are well cared for, and that we can really help you from what I know has been a very, very long year, and just as we're working through what the roadmap means. But thank you, you've done a tremendous job, and let's look forward to March and some of the other things that we've got coming up across the Trust.